I've had requests to do videos about stroke and also about aphasia, which is difficulty speaking and disability. And since most cases of aphasia that I've seen are due to stroke, I decided to combine the two, and that's what I'm going to talk about today. I'm going to talk about what is a stroke, what sort of problems a stroke causes, how to describe your problems related to a stroke if you're applying for disability or having a disability exam, and a little bit about stroke prevention and also what to do to try to improve it afterwards if you've had a stroke. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. And as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, a stroke is where part of the brain actually dies due to a problem with its circulation being cut off. The blood can't get to a part of the brain. That brain doesn't get oxygen and nutrition and dies fairly suddenly. There are two main causes of stroke. One is a blockage in the circulation, usually due to a blood clot forming in a blood vessel. That represents about 85% of the strokes. And the other is due to a blood vessel bursting inside the brain and bleeding into the brain, and that accounts for about 15%. It's really not important to the patient which type they have because they cause very similar problems. However, it's very important to the treating doctor because the treatment is completely different. Now, a stroke can occur in any part of the brain, and since the brain is responsible for so many things, everything from wiggling your forehead to wiggling your toes, strokes can cause a wide variation of problems. But there are certain groups of problems that we see commonly with stroke. There are several blood vessels that supply the blood to the brain. The biggest ones, you have two of them, are the carotid arteries, which are located on either side of the windpipe in the front of the neck. You can feel a pulse if you put your hand about here next to your windpipe. That's a carotid artery. That supplies the front and the middle and part of the back of the brain. In the back, running inside the spine, are blood vessels that go up the back of the neck and then into the skull and supply the back part of the brain. Most strokes, the vast majority, are caused by problems with circulation in the front. Strokes caused by circulation problems in the back are rare and very complicated and very different, so I won't be talking about them today. The other thing that you need to know is that your brain is crisscrossed. The left side of the brain controls the right side of the body, and the right side of the brain controls the left side of the body. So, for instance, if you have a stroke that damages the left part of the brain, you're liable to have weakness of your right hand and arm. In a typical stroke, there is weakness on one side of the body, and it can be weakness of any part of the body from the forehead down to the toes. But usually the hand and the arm are the weakest. The leg and the face are less weak. Also, a stroke may affect the eyesight, and usually, most commonly, the person will have trouble seeing things on the side that is weak. For example, a stroke on the left side of the brain, the person may have completely normal vision on the left side of the body, but lose some or all of the vision on the right side of the body, going along with right-sided weakness. The weakness caused by a stroke is what we call spastic weakness. There are basically two types of weakness. Flaccid weakness is where the muscles become loose like jello. They have very low muscle tone. They're floppy. In spastic weakness, the tone becomes greater. It's hard for you to move the muscles on the side of weakness for somebody who's had a stroke. With spastic weakness, you get increased reflexes. When you tap on the knee, for example, of a person who's had a stroke, the knee will kick harder on the side that's suffered the weakness from the stroke as compared to the normal side. Another problem that is common in strokes is what I call impaired motor coordination. The person is clumsy on the side that's been affected from the stroke. Sometimes the gross strength may be normal. For example, when you ask the person to squeeze and make a fist, they can make a strong fist on both sides, but they have clumsiness and trouble controlling the stroke side. You can see this if you ask them, for example, to button a shirt, tie their shoes, or write. Another thing that's common with stroke is loss of feeling or numbness. And this is almost always on the same side that's weak. So, for example, commonly a person will be weak on one side of their body and have partial or complete numbness on the side of the body. The final issue for stroke is problems with speech. In right-handed people, speech is controlled on the left side of the brain. So if a person has a bad stroke on the left side of the brain, they will likely have right-sided weakness and numbness, and also difficulty speaking. In left-handed people, speech is more spread out on both sides of the brain, and it's difficult to predict how a stroke will affect speech in a left-handed person. Now, a stroke happens suddenly, within minutes, and it can be completely devastating and disabling. There are few medical conditions that can cause so much trouble so fast. If we think about other terrible conditions like cancer or AIDS or Alzheimer's disease, they all come on gradually. But a stroke is more like being shot or suddenly in a terrible automobile accident. Person can go from feeling just fine to being catastrophically disabled. Now, here I want to talk a little bit about stroke prevention. It's always made me sad when I've seen a patient with a stroke, and since I did 27 years of emergency medicine, I've seen far too many people with acute strokes. The number one preventable cause of strokes is high blood pressure. And the number one thing you can do to keep from having a stroke or to keep from having a second stroke if you've already had one is to keep your blood pressure in the normal range. Here's the sad fact. Only 1/2 of Americans who have high blood pressure have been diagnosed and prescribed high blood pressure medicine. And of those people who have been prescribed high blood pressure medicine, only 1/2 of them take it regularly. Your high blood pressure medicine is not going to keep you from being disabled by a stroke if it's sitting there unused in a bottle in your medicine cabinet. You really want to take it every single day. I have high blood pressure. I take lisinopril, and believe me, I do not miss a dose. And if you're finding this video interesting, you might want to give it a like and also subscribe. I usually post a disability-related video once a week. Now, the second thing I want to talk about with stroke is for many patients, if you get to the emergency room quickly after your stroke has begun, there is treatment which can really help either make you all better or make you considerably better than you would be without the treatment. If you think you are having a stroke, call the ambulance. Don't drive into the hospital. So many people use the ambulance like a taxi. I've had people come to the emergency room by ambulance for toothache and earache. But so many people who have really serious conditions that should be coming in by ambulance drive in. If you think you're having a stroke, call 911. If it turns out to be a false alarm, big deal. But if it turns out you're really having a stroke, getting to the emergency room as quickly as possible and being treated while you're in the ambulance can make a night and day difference. Now, I'm going to talk a little bit about speech and speech disorders. You may have seen the word aphasia in the news, and it's being used incorrectly. Aphasia refers to the content of the speech, getting the words right and putting the words together correctly. Aphasia means you cannot produce any speech at all. Dysphasia means you can produce some speech, but it's difficult. In most cases, if a stroke affects speech content, it will cause dysphasia. I've only seen 3 people with complete aphasia doing disability exams since 2017. 2 of them, it was due to stroke, and 1 of them had had a cardiac arrest and had been resuscitated and survived their heart stopping, but they'd had damage to their brain from lack of circulation while their heart wasn't beating and had completely lost the ability to speak. Dysphasia and aphasia are always due to brain problems. Another problem with speech is pronunciation, and that is called dysarthria, trouble with speech pronunciation. And we've all seen people who are drunk and slurs their words. That's a form of dysarthria. Dysarthria can be caused by brain problems, including stroke, but it can also be caused by problems with the mouth, throat, vocal cords, and breathing. For example, I had a patient last year applying for disability who'd had cancer in the mouth and had required extensive surgery, and after the surgery had difficulty pronouncing their speech. Now, when somebody loses the ability to produce speech content, it's usually global. They have trouble speaking, and they have trouble writing. And they may also have trouble understanding what other people are saying. My favorite test for understanding is to tell the patient, touch your right ear with your left hand. If the person is right-handed, they probably never touch their right ear with their left hand, but it's a simple instruction that's easy to follow, and it will give you an idea of whether the person can understand your speech. For dysarthria, I like to have the patient repeat Methodist Episcopalian. It sounds difficult, but anybody with normal speech can repeat it with ease. For trouble with the content of speech, I like to ask the patient to name 3 things, and I use a pen, a watch, and a stethoscope. This will often pick up subtle difficulties. For example, I've asked a patient who'd had a stroke, "What is this?" And they said, "A clock." Well, that's close, but it's no cigar. Both a clock and a watch are round and have hands and tell time, but they're not the same thing. Likewise, I asked a stroke patient, "What is this?" And they said it was a pencil. Again, close, but it's obviously not a pencil. If a person has dysphasia or aphasia, it likely affects all their language ability. I had a patient last year whose native tongue was English. However, his mother had been born deaf, and from childhood he learned American Sign Language. When he had his stroke, he completely lost the ability to speak in English, but also completely lost the ability to communicate with his mother using sign language. Now, once a stroke has happened, there's a huge variation in how much the person can recover. Almost everyone recovers some of the function that they lose initially when the stroke first occurs. And this happens because of 2 reasons. Number 1, the brain heals somewhat, usually not completely, but somewhat. And number 2, the person often can retrain themselves to regain some of the abilities that they've lost. For example, I've seen a right-handed person who became paralyzed on the right arm and hand and lost the ability to write, but taught themselves how to write with the left hand. The amount of recovery is completely unpredictable. I've seen everything from complete 100% recovery, which is quite rare, to 0 recovery, which again is quite rare. Because most people improve somewhat and it's unpredictable, Social Security requires that you wait at least 3 months after a stroke before applying for disability, because most of the recovery occurs initially. Not all, but most. So, if you've had a stroke, or if someone you know has had a stroke and you want to apply for disability, what is important? Well, first of all, chances of being approved for disability are high with a stroke because usually a stroke affects multiple work-related abilities, often severely. However, because a stroke can affect so many different things, you must specify exactly what sort of problems you're having difficulty with. Do you have trouble with vision, with speech, with weakness, with clumsiness, with loss of feeling or numbness, with problems with balance, and it's fairly common to have difficulties with memory and thinking, although usually those are not severe. So you want to spell out in detail your work-related limitations when you're filling out Social Security Form 3373. And you also, if you're going to have a consultative examination, you want to describe your limitations in detail and then demonstrate them during your physical exam. Now, finally, one more word about what to do if you've had a stroke. Almost everyone who's had a stroke goes into a deep funk, becomes very sad, and often clinically depressed. And unfortunately, they often give up and just isolate themselves and sit on the chair or lie on the couch all day. You can improve your situation if you've had a stroke, but you need to push yourself. Physical therapy, speech therapy, and occupational therapy can be very helpful. I recommend exercising both sides of the body, the weak side and the normal side, at the same time. I often suggest to patients that they get an inexpensive set of dumbbells. You can get them at Walmart for about $40 and use them every single day. The more you push yourself after a stroke, the more you will improve, and some people will continue to improve more than 1 year after they've had a stroke. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.